Good evening, everybody, and welcome to session 3 of the 2025 Tennessee Family Series. We are so glad that you have joined us tonight. We're going to take a couple of minutes for everybody to get in, get settled, find yourself a comfy seat, get you a good snack, and we are going to get started here in just a couple minutes, but we are so glad that you're joining us tonight. Well, Big Orange, welcome to everyone who is joining us tonight. We are excited to welcome you to session 3 of our 2025 Tennessee Family Series, where we are talking all things health and wellness tonight. We have got a lot of great folks who are here tonight to share with you about resources that are offered, answer questions that you may have, and provide information that will be helpful to you and your student as you get ready to start your Rocky Top experience or continue your experience this fall. We want to hear from you tonight, and so you will see at the bottom of your screen is a little Q&A button. This is how you will be able to submit questions for our panelists. So as the questions are answered, they will appear in the all questions where everybody can see those. We do ask that you not resubmit questions. We are going to get to as many questions as we can, either live or with our staff or our panelists responding to you within the question and answer feature, but just make sure only to send it once so it doesn't get bogged down with repeat questions. So that Q&A feature is available. The chat will not be available for you to send anything in. Send all your stuff in the Q&A, but if we have any important links or information we want to share with you, you will be able to find those in the chat. So, panelists, welcome. Thank you for joining us tonight. I'm super excited to hear about all of your areas. So, we want to know who you are. So, I'm going to ask if you all will go around and tell us your name, tell us the office that you are with, and tell us a little bit about what your office does on campus. So, we're going to preset the order. Remember where you're at in line because we're going to do this a few times tonight, and it's based solely on where you're at on my screen. So, we'll go Lori, Rebecca, Lisa, Katie, and then Jess. So, Lori, kick it off. Tell us about what you do on campus.
Hi, everyone. My name is Lori Duselier, and I'm the director of the Center for Health Education and Wellness. And in our department, we do education and outreach about alcohol and other drugs, sexual misconduct prevention, general health and wellness, including stress management, mental health promotion, and sleep promotion. We do programming around the 8 dimensions of wellness, and our intention is to help students stay healthy and be as productive as they can be while they're here in college.
Hello, everyone. My name is Becky Morgan. I am the director of the Student Health Center on campus. We provide primary and acute health care to all the students on our campus who are enrolled. We take care of quite a few different areas. We have different areas of the clinic for same-day appointments. We have a women's health clinic. We have primary care clinic, sports medicine, physical therapy. We have a psychiatric clinic. We have an allergy clinic so that people who have already been evaluated by their allergist can bring their serum and their orders and get their allergy shots while they're on campus. We also have a travel clinic so that if your student is going to be traveling, they can get their advice. A lot of the medications and immunizations, some they have to get from the health department, but we'll help them take care of getting prepared for that travel.
Thanks, Dr. Morgan. Good evening, everyone. My name is Lisa Lohr, and I'm the director of the Center for Care and Resilience here on campus. And at the Center for Care and Resilience, our primary responsibility is to staff the university's 24-hour helpline. And so we have a helpline here that a parent or a student could call if they were in distress or had a need or had a question about navigating the university. And that number is 865-974-HELP or 4357. We provide strengths-based case management to students for any kind of distress that they might be experiencing, maybe a roommate conflict that they don't know how to resolve, or they have questions about where to get connected with something on campus. Perhaps they are having some stress or anxiety. We can help get them connected to mental health resources. We provide mental health first aid trainings to campus community, so that includes students. We also are engaging in something called Heart Math, which is a biofeedback mechanism that is with non-clinical staff. So our case management team will be able to help students who might be experiencing stress. We'll run them through the Heart Math program. And then we also have a group of clinicians who are embedded in the counseling center that work alongside of the counselors at student counseling to provide crisis mental health counseling services on campus.
Hello, everyone. My name is Katie Locke. I'm the director of Rec Sports. We are where the fun happens on campus. We have three facilities. Two are on campus, the Tennessee Recreation Center for Students, or T-Rex, the Student Aquatic Center, and then off campus, we have the Sutherland Field Complex. We also have a variety of programs and services that your students can participate in, anywhere from club activities and intramurals to group fitness classes and just pop-in recreation. In addition to that, we also hire students. So we have lots of employment opportunities. We have over 400 students that work for us. So if your student is looking to get connected, Rec Sports is a great place for them to visit.
Hi, everyone. My name is Jess Westcott. I am the Assistant Director at the Student Counseling Center. I think we also have a lot of fun over at the Student Counseling Center, maybe a different kind of fun, but we provide brief, short-term individual therapy to students. If they call to schedule an appointment, they will first meet with a triage clinician that are actually with the Center for Care and Resilience. In that meeting, they'll discuss what the best fit, what the needs of the students are, how UT, the Student Counseling Center, other resources on campus could provide services for those needs. If they get referred to us, again, we provide brief short-term individual therapy. We also provide group therapy services. We have lots of group. I think last semester we had 12 groups that were running for undergrad, graduate students. And then we also provide outreach and consultation to faculty, staff, student groups, etc.
Wonderful. Well, thank you, panelists. Thank you for being here with us, and thank you for sharing a little bit about what you do. So I want to move into some of our questions that we've been receiving. And Becky, I want to give the first one to you. So we've had a few questions come in about questions around vaccines. So if you could tell us, are there any vaccines that are required or that you would recommend for students before they start at UT? And then if there are there opportunities or ways that they can go to the Student Health Center to receive these vaccines?
That's a great question. And I'm happy to answer that. If you have a student who will be living on campus in university housing, you do have a requirement to be vaccinated for the usual vaccines that students have to get into school in elementary, middle, and high school. The DTP, MMR, and all of the vaccines that they may have gotten, but those are the major ones. For living in the dorm, we have to have a meningitis vaccine. That is a high risk area when you're living in close quarters with so many people. So that is a requirement for you to be able to move into your university housing, is to have a meningitis vaccine. We have a particular, it's the ACWY meningitis vaccine. We can give those vaccines at Student Health. They may also get those vaccines at any pharmacy or at their primary care doctor before they come to school. Our pharmacy in the Student Health Center does give vaccines and can charge insurance. The Student Health Center does not charge insurances, so it is best if you can use your insurance and get your vaccine before you come to campus or in our pharmacy before you move in, so that your insurance will cover that vaccine. During your time at UT, we also help you stay up to date on your immunizations. So we can give tetanus shots. We can update your DTP, which in particular deals with pertussis, which is having a resurgence. It's also known as whooping cough. So we can update those vaccines so that you stay out of harm's way while you're in school for 4 years.
Awesome. Thank you, Becky. Great information. I appreciate you diving deep into that and kind of what all those pieces look like. Lisa, I want to throw it to you about a question we had come in about 974 help. And so, it's some folks that are asking, well, what if it's after business hours? Can myself or can my student still call 974 help? And what can they expect if they're calling after business hours? So can you tell us a little bit about that?
Sure, absolutely. Great question. Thank you for that. So 974 help is a 24-hour helpline. It is staffed by professional staff kind of during the traditional business hours. And then we have an answering service that takes calls after hours. And so they will kind of listen to the concern and make a determination, perhaps get you connected to a crisis counselor if needed, or other immediate resources if the situation is emergent. And then if not, they'll kind of give you some strategies or give you those resources that they can, at 2 a.m. To get you connected appropriately. And then our staff will follow up the next business day.
Wonderful. Thank you, Lisa. I appreciate you sharing about that.
Yeah.
Jess, I want to throw the next question over to you. We've had some questions come in about what long-term counseling looks like for students who may be seeking that. So can you kind of just describe what that process may look like from the moment that they begin receiving services from the Student Counseling Center, and then what that can look like long-term for students?
Sure. So as a blanket statement and operation of the student counseling, we don't provide long-term therapy. This is pretty consistent across college counseling centers, especially larger universities. You look at how many students we serve and the number of clinicians on staff. We would not be able to serve nearly as many students as we do if we offered long-term therapy. So if students call, they're interested in services, again, they'll first get set up with a triage clinician with the Center for Care and Resilience. That is a brief assessment, but it's also intended to be a collaborative brainstorming and solution finding session to figure out what is the best fit for the student. Of course, there might always be exceptions, but in general, we don't provide long-term therapy. That's often where the triage clinician will help the student get connected with the Center for Care and Resilience case managers to help them provide or help them find off-campus care. So whether they have insurance, not insurance, there are also some department clinics on campus, like training clinics, and they do provide longer-term therapy. So that might be a potential referral source. The one consistent exception to our services is group therapy. We love group. Sometimes group is a harder sell for students, and we tend to find that it is as effective or if not more effective than individual therapy. And that is unlimited. Students can access, only one group per semester, but they can access group therapy for their entire time at UT. So I hope that answered the question. Again, I know it's not sometimes what parents and students are looking for. They're wanting to find a long-term therapist that students can get connected with and be with during their whole time at college. And that would make it really hard for us to serve the general student body. So that's where we'll be looking for off-campus care.
Yeah, that's great, Jess. I appreciate you sharing those details about the services you all offer and what, kind of are off-campus services to search out for. So thank you, Jess. Katie, I want to move it to you and with Rec Sports. So we've had a couple people ask about employment with Rec Sports and can my student work at Rec Sports and what does that look like? So kind of break down what employment looks like at Rec Sports, process, jobs, all those good things.
Yes. So Rec Sports, like I said, has over 400 student employment opportunities. That's the number of students that we have working for us. The application is on the Rec Sports website. It's actually called an interest form. Once they complete the interest form, depending on what they show as a preference, then they will get an additional application form. That application form will help answer questions on whether or not what we need and your student has available will match well. If a student isn't picked for, say, an informal recreation job, those are the people that sit at the desk, there's still a lot of program jobs that students can get involved with. And a lot of times our freshmen come to campus and don't apply for jobs right away. That's okay. They are still likely to get a job with us through our intramural program. They always hire after the school year starts. If Rec Sports isn't the only place, there are lots of other places on campus where students can find jobs, and there are a lot of great opportunities. And it looks like the employment application has been dropped into the chat.
Awesome. Thanks, Katie. I appreciate you sharing about that. And Rec Sports is a fantastic place to work. So thank you so much for sharing about that. Lori, want to throw it over to you now. And thinking about, just kind of general health and wellness, what are some of the conversations you recommend that families have over these next few weeks before we get to August and move in and all the business that comes with that, just around health and things they can remind their students of and conversations they can have that will benefit their student as they prepare for this transition?
Yeah, thanks, Todd. That's a great question. Around general health and wellness, really talking about techniques that they use to manage stress. And there's a whole variety of ways that people do that, whether it's through exercise, going for walks, meditation, yoga. I can't stress enough the importance of getting enough sleep, and that can be perceived as really hard to do during college and in life. But sleep is so important to our mental health and our physical health and being able to stay awake in classes. So if students can get into a routine of having a bedtime and a regular wake time to get up and have some breakfast and get ready for class. So really managing stress, getting sleep and some exercise, good nutrition through the dining halls, eating on a regular basis so they don't get too hungry throughout the day. Also, students really do care about their family values around drinking and relationships. So hopefully you've had the opportunity to have conversations around that. A lot of first-year students come into the university having not drank alcohol or drank very much, and they will be exposed to it on campus in general. So just having conversations about your values around that, and also safety planning, just who to call for help if they need it at any time. And of course, there's a lot of resources here on campus to help them, as we talked about 974 HELP and the Center for Health Education and Wellness, the Counseling Center, all kinds of helpful resources, student health, all the resources here. But just having conversations about taking care of themselves and just being open to if they have any questions about any of those things.
Awesome. Thanks, Lori. All great advice, all great conversations to be having over the summer. Becky, want to come back to you. You've hit on it a little bit, but want to expand a little bit more on it. And that's our pharmacy on campus. So can you tell us just a little bit about what all that pharmacy offers, and then touch on things like if a student already has a prescription, can they transfer it to the student health center? Do they pay for that through their insurance? Just kind of what all those details look like for students who want to utilize the pharmacy within the student health center.
Certainly. Our pharmacy is basically just like a pharmacy in the community. They can fill all types of prescriptions. They can accept all different types of insurances. They also can provide vaccines. They're probably our best partner in providing flu vaccines every year. So the only thing that's missing from our pharmacy is all the miscellaneous things that really you don't need in a pharmacy, like, drinks and snacks and that kind of stuff. They have a full compendium of over-the-counter medications. If anybody has questions, we have very experienced and wonderful pharmacists. They give great advice. They do an amazing job trying to cost control a lot of the the prescriptions that we commonly prescribed at the Student Health Center. They're also extremely good at following through to kind of be a safety net on interactions and allergies and things like that. So a student who comes to the University of Tennessee can get their prescription from their home pharmacy transferred to the pharmacy that is inside the Student Health Center. If they come to the Student Health Center and they're prescribed a new prescription, they can go right down the hall, and in most cases, they can get that prescription on the same day. So it is a wonderful service, and the people who work in the pharmacy are there because they love college health, and they do a wonderful job of partnering with us to help keep all of our students safe and healthy.
Thanks, Becky. Great information, another great resource you all have. So I appreciate you sharing more about that. Katie, can you tell us a little bit about some of the intramural and club sports that we offer and what that process looks like for students who want to participate in intramurals or in club sports?
Yeah, I'll be happy to. So our intramural program is very recreation based. We offer a variety of sports where students can participate on teams and play on campus. Or we have some individual sports that they can also play on towards a winning prize. If their team wins that tournament, then they get a team t-shirt that is pretty cool normally. Our sport clubs are very similar to what your student may participate in at home year round. And those are have a wide range of clubs. So some of the more traditional clubs that you would think about would be ice hockey, rugby, lacrosse, basketball, and I think almost all of those, except for basketball, have both men and women's teams. And then we have some non-traditional club sports, bass fishing, fencing. We have a dance competition team. Clay target is another unusual one. So there's a lot of opportunities for students to participate. Our clubs travel. There are dues. So if you are already paying dues for your club, for your student to participate in the club that they love, those dues are probably going to be the same because they still need to buy uniforms and travel and compete. I think that we are very fortunate. The majority of our clubs perform very well and make it to finals. And I think that it's a really great way for our students to get involved and connect on campus.
Awesome. Wonderful. Thank you so much, Katie. Lori, I want to go back to you for our next question. So, I think one question we see a lot from families because of, students being in a new environment is around eating habits. And so that, they go from kind of their normal eating pattern to now they've got Chick-fil-A at their fingertips at any point. But we know that Chick-fil-A and Starbucks is not enough for a balanced, healthy diet. So can you tell us a little bit just about kind of conversations you recommend having and resources on campus about eating healthy?
Yeah, that's a great question. And as you said, there's some great options available and a lot of all you care to eat options. So it's usually an adjustment for students to see what's available to them, try the different options, and see what they like. Of course, trying to get more vegetables and fruits on a regular basis is more healthy for all of us. So encouraging them to remember that. Um, if they can get up and get some breakfast, that's really important to get off to a good start and be able to focus better in classes. Because we all know if we're hungry, we're a little distracted by that and their energy might get low. So, getting some breakfast, regular lunchtime, and trying to get in some fruits and vegetables mixed in with all the other options is a great option. If people have specific questions or needs, there is a dietitian available in Vol Dining, and they can talk to them about food allergies or other special needs. There is a specific floor in the dining hall, Rocky Top Dining Hall, for students with food allergies. So that's a good option. And typically they can find other options in the other dining halls as well. So there's good resources available, more choices than we could ever imagine when we were in college. There's a lot of great options out there. So just encouraging a variety of foods.
Awesome. Thanks, Lori. Great advice and great conversations to be having. Lisa, I want to throw it back to you. And so, you've talked about the 974 Health kind of referral process, but can you kind of tell us how your process from the referral to the services offered differ from something like a student success report, a student conduct report, or some of those other mechanisms that we have on campus?
Yeah, well, the first thing is anyone can make a referral to the Center for Care and Resilience 974 Health team. So a concerned parent, a student can self-refer, a student could refer a friend if they were noticing signs of distress. And once we receive that referral, our team we kind of assign it a level of care based on kind of what the presenting concern is. And so we then do outreach, and we will reach out to that student the next business day and connect with them. We'll reach out via text, via email, and via phone. So whatever option works best for that student to respond by is how we want to connect with them. We talk to them about our services. We're there to provide support, to advocate, to kind of come alongside of that student and help them navigate whatever it is they're dealing with. So, so anyone can make that report. It's not based on a code of conduct, or it's not based on any specific kind of regulation. It's just, hey, my friend seems to be having a really hard time. And so we reach out to that person and we let them know we're here to provide support. We want to provide care. And here are the resources we think we can help you with. We try to kind of get that up front, whether it's finding an off-campus provider for mental health or physical health, or getting established in maybe the student's Center for Academic Success, right? So we help get them connected. We may even our students who might be demonstrating some basic needs insecurities, we have a little care cart, and we'll take them over to the Big Orange Pantry and help them kind of check out through their first process if they have concerns or reservations about doing that. So it's really about getting connected, providing basic mental health support, and really giving them a person on campus that can be kind of their go-to, versus like conduct, which is really a formalized process that has some, there's a concern that maybe the student has violated a policy of the university's handbook or something like that. So it really is supportive. I will say that students can also decline our care. So we don't mandate care. So if somebody makes a referral, we reach out to the student, we connect with that student, and they say, yeah, I'm just not interested right now. We certainly want to leave the door open for that student to connect with us in the future if they want to, even the next week if they change their mind and say, yeah, I do want some help. But we do not mandate care.
Thanks, Lisa. That's all fantastic information for our families to have. So thank you for sharing about that. Jess, I want to move it back over to you. So we've had some questions come in about, what families can and can't know, and will they be notified if their student, uses the counseling center? Can families call and get information about appointments or what was discussed? So can you kind of tell us really what that dynamic looks like, kind of some of the legal aspects of that, just all those fine points that go into the services you all provide for students, and how it comes to the family aspect?
Yeah, those are great questions. So we are a confidential resource. So what that means is that we fall under confidentiality, similar to any adult going to therapy, doctor. So no, we don't release any information to anyone unless they are the student themselves or we have a release of information. The exception of that being if a student is under the age of 18, right, because they're not yet a legal adult. But if any of our students are accessing services and they're 18 or above, we can't release any information. If we have anyone call, a parent, a friend, we might try to help as if it's a hypothetical situation, but would not disclose any information about the student themselves. And most likely, the person calling would get a response like, we can't confirm or deny that that person is even a client here. Again, unless we have a release of information. So if the student wants there to be communication between, let's say, the counselor and a parent, then they would fill out a form allowing us to be able to communicate. There might be some information in there about what feels okay to communicate and what doesn't. There would be an expiration, usually no more than a year. But yeah, we don't really provide any information at all. Hopefully that answers your question.
No, absolutely. I think it's great. I appreciate you detailing that and how it still works like a normal healthcare provider, and how just because it's on
Yeah.
our campus, we still hold that privacy in the highest regard for our students. And so I think that's just something
Yeah.
important that families make sure they understand that how that works. So
Yeah.
I appreciate you sharing about that, Jess.
Yeah, and it really is
What
to honor your students' identity as an adult, right? This is an exciting time. They're emerging adults, and so we also want to treat and respect them like they are. So.
Absolutely. Absolutely. Thanks, Jess. I appreciate you sharing about that. Becky, want to throw it back to you now. And so we had a question come in about after hours care. And, what do you recommend for students who maybe it's a Sunday and they have a fever? So, what does that look like for students who need those services when the student health center might not be open? Oh, Becky, you're still muted. Perfect.
How about that? Okay. I'm better at practicing medicine than doing Zoom. I just want to let y'all know. So we have options for your students after normal work hours and overnight, weekends, holidays. They can call the Student Health Center number, and we have a 24-hour call center with registered nurses where they can get advice and they can get some self-care recommendations as well. We also partner with the University of Tennessee Medical Center, which is quite literally across the river from the Student Health Center. They will see our students, and we have an agreement with them that they will provide a discount for the emergency room fee. There's a lot of other costs that come into play, so it's always good to have that insurance card. But the emergency department at UT Medical Center does discount their fee for our students, so that it can make it a little easier for our students to be seen. If that's not going to work for them, we are 5 minutes from another major hospital, Fort Sanders, just up the hill, as they say. We have several urgent care clinics that are within a 5-minute drive. So we have plenty of medical facilities in the event that someone needs assistance outside of our usual hours. We have a triage nurse line that operates during the week, during hours, that can also help provide information and advice to students when coming to the Student Health Center may not be something they can do at that time, but they still want information about how to provide self-care.
Thanks, Becky. I'm going to ask you to stay unmuted because I'm going to throw you on the spot and give you another one. You mentioned something that we've gotten a few questions about, and that's insurance. So can you kind of break that down about, are students required to enroll in a health insurance program? Are they required to have private insurance? Do we offer insurance for students? So can you just kind of give us that general rundown of what insurance kind of looks like for our students on campus when it comes to the Student Health Center and other medical services?
Absolutely. Insurance is one of the most tangled webs that we have to deal with in medicine. First, I'd like to explain how a student can be seen in the Student Health Center. If your student is enrolled in classes and they've paid any portion of the student program and services fee, then they are eligible to be seen at the Student Health Center, which means that they can call, make an appointment, and see a provider without cost. They never pay to see a medical provider. If we have to do tests such as lab work or x-rays, or we need to give them some sort of assisted device so they can get around campus, like a boot or crutches or an ankle brace, those will cost. They are, we have worked very hard to negotiate prices that are very affordable. For instance, getting a blood count done at the Student Health Center costs $10. I've never been to a doctor where you can get a blood count for $10. We can do all kinds of rapid testing. We can do, and most of our tests come back within 2 to 3 days. As far as insurance goes, we have students from so many different states with so many different insurances. We do not have the ability to charge insurances for all of those options. That is why we have very affordable prices on any of the things that we charge for. And we also do not have the student pay. They don't have to pay at the time of service. That charge will go to the bursar's office the Monday after they were seen, and they can pay that bill when they can do it. Now, we do offer a student health sponsored insurance plan. It's United Healthcare Student Resources. That insurance does pay for all of the things that are done inside the Student Health Center. So that is the only insurance that we actually can bill for our services. But again, they don't get billed to see a provider. They just get billed for the extras that we do. That insurance also works in the community. They just need a referral from a student health provider, and they can use that United Healthcare Student Resources and see any community provider who's on the plan. So in summary, they can come to the health center and they can be seen, and a lot of times they don't pay anything. They can come to the health center and they may have some blood work or some x-rays done or get some other type of orthopedic appliance, and they may have a bill. Our x-rays are $20, and most of our orthopedic supplies are very affordable, very different than if you go into the community. If they choose to go outside of the clinic with the student health insurance, they need a referral. I think those are the key things to remember with respect to the Student Health Center. Hope that answered everybody's question. And the students are not required to have insurance. They're not required to have any kind of insurance. We strongly encourage them to have it because you never know when something quite significant may happen, even to young, healthy people. But it is not a requirement of the university.
Thanks, Becky. All great information. I appreciate you giving us the breakdown and kind of all the pieces of the health center. Super, super good to know for both our families and our students. Lisa, I want to turn the next question over to you. And so over the next, 6, 7 weeks before we get to moving, this is the perfect time to have conversations about navigating resources and asking for help and seeking those out. So can you give us just some advice for our families about how to encourage students to seek out resources like 974 Help or other departments here, and how families can really empower their students to, ask for help when they need it?
Yeah, that's a great question, Todd. I think the first thing is just being aware that we are a campus resource, and you can make a referral before a student comes to campus. So if you would like some support even this summer, or just kind of get to know the 974 Help team, maybe you have a student who is already in treatment, or maybe a student who has needs that you think they may need some support navigating the university, go ahead and make that referral now. I think that's the first thing. The second thing is really early intervention is so helpful. So if at the first sign of distress, really making sure that that student is getting connected to support. A lot of times what will happen is a student will kind of get in over their head during the semester, and then not be aware of resources, or not want to reach out for help. We can oftentimes intervene and advocate for a student who is struggling in a class. But if they wait until the end of the semester to say, hey, I didn't do well in this class and there's only 1 week of class left, that limits the way we can help them recover, right? So I'd say early intervention is key. And then really just checking in with the student to make sure, hey, how's it going? Do you have any questions? Really asking that student how they're navigating campus, and finding out if they're having any difficulties that we might be able to support. Again, I think the big thing is just knowing that we're here, knowing that the resource exists, and early intervention are the three big kind of pieces to that.
Yeah, that's great, Lisa. I appreciate you sharing about that, because I think, families can be our biggest allies in how we support students. And so, that knowing that they can play a role in this and those tips, I think, are super important. So thank you so much, Lisa.
Yeah.
Katie, want to throw it back over to you. So, what advice do you have, really kind of for students that families can share about getting involved in a space like the T-Rex? Setting up habits for exercise and kind of building this physical health piece into their schedule early as they're developing these new habits that all come with college. So, any advice you have, would love to hear.
Well, I think that our students should really spend a few minutes with their schedule to see what works best. I'm going to echo what Lori said about making sure that they have good, positive sleep habits. But coming over to T-Rex, there are lots of things to explore. There are several floors. There's an outdoor pool. There's an indoor pool. I think that students should come with an open mind and an opportunity to find a niche in our spaces. We also share space in the hyper building. So we have a climbing wall over there where probably I think 40 to 60 students hang out at night. So I think it just depends on what your student does. I do highly recommend that they come and spend some time with us. JMU has a great program where students come 30 times during their first semester. I think that getting in a healthy habit, making sure that they're doing some sort of exercise, whatever exercise that makes them feel good about themselves, is really positive for their future.
Awesome, panelists. Awesome, Katie. Thank you so much. Panelists, we are starting to round out our time for tonight. So, want to give you all an opportunity to share some closing advice, and we will go in the order that we started the night in. But any closing advice you have for families, anything you may not have gotten to touch on this evening, just kind of that closing wisdom you want to share. And then if you will share ways for your student or ways for students to connect with you now through social media, your websites, or how they can connect with you once they get to campus. So, Lori, I'm gonna have you kick us off.
Sure. I'm just going to reemphasize having those conversations with your students around taking care of themselves, um, having discussions around your family values, around alcohol and relationships, and also having an open door for questions and knowing where to refer them in case they have questions. In case they're, if they're not comfortable talking to you about something, there's a lot of offices that can help them, and that's what we're here for. So just overall, taking care of themselves as far as getting sleep, managing their schedule, and reaching out for help if they have any questions. Thanks.
Thanks, Lori. I guess I have two pieces of advice information for the students. Again, I would echo the sentiment of getting in touch with us sooner rather than later. Don't wait until they're just terribly sick. And sometimes they can call and talk to one of our triage nurses and they find out, okay, this is what everybody else has right now too. It's just, there's some good self-care things you can do. And then if that doesn't work, call back, we'll get you in. So we're going to work with them. We're also going to help them understand and improve their knowledge base so that they can access healthcare with a little bit more education and a little bit more confidence. And to the parents, I will tell you that our staff, we have quite a few people who have been at the health center for many years. And the reason is we love this age group. And we have a staff that works so well together. We always say it's like a family. And the core reason is that we love this age group and we love our students. So please know that we are going to take really good care of your children while they're here in college. And then they're going to leave adults who are ready for life. So please know we're here to do the best we can. There's a lot of people on campus now, but we promise you we will do the very best that we can to give your child the best medical care possible. Thank you.
Yeah, Todd, I would echo what Dr. Morgan and Lori have already communicated. Early intervention is the key. Having those conversations up front is really helpful. The one thing that I don't know that I mentioned explicitly is, and Lindsay, thank you for the contact information. If someone would like to make a referral but doesn't want to call us necessarily, they can go to the care.utk.edu website and do an online referral. And so that'll give you a chance to kind of fill out a form and tell us a little bit about what's going on. And you can do that 24 hours a day. We respond to those in general the next business day. But yeah, we're here for your students. We want to help them be successful. We want to help them navigate the university system well and thrive inside and outside of the classroom. And that's what we're here for. So that their college experience is just phenomenal here at UTK.
Want to remind everyone that at the beginning of the school year and the beginning of the spring semester, we will have registered student organization fairs, and we'll also have an event at the rec center called Rec Fest, where students can find organizations and groups and ways to connect. And I think that it's really important to tell your students to invite friends, bring friends with them where they go. And if that's not the right friend, ask another friend the next time. They'll find their people.
I don't know if I have a whole lot to add because everyone has said wonderful things. So ditto, echo what's already been spoken. I often encourage parents to try to look for changes that might be happening, right? That's one of those early signs that we might see. You hopefully know your kids. If you start noticing significant shifts in how they're acting, appearing, it might be a good time to just give a gentle nudge. Hey, have you thought about reaching out for services? Like others have said, early intervention is key. Um, and bring up group therapy. Again, we love group therapy. It's the hardest thing to convince students to do, but they love it once they are in it and committed. So maybe start putting a little bug in their ear now to try group. And our Instagram handle is UTK Counseling Center. So there's some good tips posted there. So encourage y'all and your students to follow.
Awesome. Thank you all so much. And participants, you can see here that contact information. So definitely make sure you check out all the wonderful resources, websites, and things that you can find here for even more information than what we've discussed tonight. Panelists, I want to thank you all so much for joining us tonight. Thank you for sharing your wisdom, your guidance, the knowledge you have about all of the wonderful services that you all offer to our students. So thank you all so, so much. Families, we are so glad that you joined us this evening for session 3. A couple quick reminders. We want to make sure there is the online orientation that's available, Vol 101. So make sure if your student hasn't completed that or you haven't done some of those portions geared for families as well, make sure you do that because it gives you a lot of great information about UT, all the resources you've heard tonight, and so many more. And also, if you haven't already joined, make sure you join the Tennessee Family Association. This is free to join, and this gets you access to a lot of great information, including our Family Hub, where you will find information about all of these departments that were represented tonight, including all sorts of other departments across campus. And then make sure you join us again here, the same place on Zoom in 2 weeks for our next session. We'll be talking all things student success. So that is 2 weeks from tonight, 7 p.m. The date for that is July 10th. We appreciate you joining us tonight. We are so excited to welcome your student to Rocky Top in just a few weeks, and that we get to welcome you as well into our volunteer family. We hope you have a great evening, a great rest of your week, and as always, go Vols.